So hi everybody, it's Dr. Sarah Moore here, and today I have the pleasure of speaking with Martha Ging. So Martha is a midwife and lactation consultant, and I work with Martha in Busselton, and we're going to speak a little bit about her role in supporting mums with breastfeeding. So thank you, Martha.
Thank you, Sarah. Good to chat.
Yeah, lovely. So Martha, let's start off by just talking about why you're so passionate about supporting women to breastfeed.
I guess on one hand, there's the science behind it. So we know how important breastfeeding is for mums. We know how important breastfeeding is for babies, for their health, and for mums' health as well. But putting all the science aside, I also really value the role that motherhood brings, and also the changes. So when a baby is born, it's not just the birth of a baby, but there's the birth of the mom as well. So there's all these huge reasons to really value and, I guess, nurture and help mums to grow into that. We know that if mums are well, their families are healthy and stable as well. And if we have healthy, stable families, we have healthy community. So there's all the little things, but then there's that big, huge, wide picture as well.
Absolutely. Oh, it's beautiful, and I couldn't agree with you more. So, Martha, I thought we could touch on some of the common myths that you come across that women bring to you when you're consulting in this space around breastfeeding, and yes, perhaps correct some of those for the people watching.
Well, there's lots and lots and lots of myths around breastfeeding, and I don't know how it's happened, but somehow we have all these rules about breastfeeding, and we've made it super complicated. So one of the things I hear all the time is about the food that women can eat while they're breastfeeding. I hear all sorts of crazy things about that. So to put it into perspective, basically whatever food that a woman tolerates and eats during a pregnancy, of course she can eat that when she's pregnant, or when she's breastfeeding, sorry. Yeah. And then if she's going to introduce something new or different, like soft cheese or some meat or deli meat or something like that she hasn't had during the pregnancy, just introduce one thing at a time. It's a little bit of common sense. If you eat the whole head of broccoli, you're going to have a bellyache. So is your baby. Yeah. If you eat the whole head of cabbage, you're going to have a tummy ache. So is your baby. So there's no rules when you think about all the different cultures around the world and the different types of food that they eat. Babies thrive on that breast milk as well. So no rules there. Whatever the mom tolerates, whatever she's happy with, baby will be fine with that as well. Another really, there's a lot of myth or misinformation about the frequency of breastfeeding or scheduling breastfeeding. Babies don't thrive on that. Babies thrive on being responded to, and they give us very clear cues about when they want to feed and for how long they want to feed as well. So I try and talk to families about just throw away that clock. Don't schedule your feed. Instead, learn to read your baby's cues and respond to them. If they're giving us a signal that they need something, you might not always know what that is, but you go through this little list of, check their nappy, maybe they have a bit of wind. More often than not, they just want to feed because they get so much more from breastfeeding than just the milk. Yeah. And then I guess the other thing is about the length of time that women should breastfeed. So the World Health Organization tells us that women should exclusively breastfeed until their baby is 6 months old, and then continue breastfeeding for at least 12 to 24 months. If you look at that globally, when you look at other cultures around the world, cultures that really value breastfeeding, they breastfeed their children till they're at least 4 to 5 years old. So when you look at our development as humans, the size of our brain compared to what a newborn can do when they're newborn, and you compare that to other mammals across the world who can actually get up and walk and find their mother, our babies are really dependent on us for much longer than other mammals. So 4 to 5 years old is quite the norm, in lots of other countries. So yeah.
Yeah. Fabulous. Okay, thanks, Martha. That's all really useful and valuable information. I thought now we could talk a little bit about the common problems that you see in your practice and that you support women with overcoming in relation to breastfeeding.
Sure. I guess the number one common problem is sore nipples. Okay, so a lot of the time it's just a kind of a match and fit problem. So if you can get that baby on a little bit more deeply, or show mum how to do that herself, a lot of the time you can correct that. It shouldn't be painful. It does feel a bit different, particularly to first-time mums. They haven't experienced that sensation before, but it certainly shouldn't be painful. If the pain persists, then there might be some other problems behind that as well. So it's worth your while just to sit, watch that mum breastfeed, see if you can get that latch in that position a little bit better, just to tweak it a little bit, and of course teach mum how to do that herself. Another really common problem is mums that doubt that they have enough breast milk for their baby. And it's hard because they can't actually see the amount that the baby's drinking. But if you can teach mums how to know that their baby has had enough, so what are the signs that babies tell us that they've had enough? Usually it's their output. What goes in needs to come out. And if they're growing and if they have settled periods during the day, you can see their clothes getting a little bit tighter. And then for mums as well, how to assess their own breasts and their own supply as well. That gives them the confidence that their supply is adequate for their baby. And one that I've been seeing a lot recently is babies who are starting to fuss at the breast. So it's babies that are a little bit older, and they're starting to, maybe at particular times during the day, fuss a little bit. And for the mums, that's hard because it feels like they're rejecting them. So we go through, watch what the baby's doing. It can be a problem with mum, or it could be something going on for the baby as well. And sometimes, by the time baby gets to about 3 or 4 months old, they're starting to develop a little bit of personality. They're starting to give mum a bit of cheek at that point. So sometimes it's just something simple like that. So yeah, they're some of the common ones that I've been seeing.
Wonderful. Great. And I think, similarly, I see a lot of that in my practice. And so it's really wonderful to be able to refer them on to someone like yourself to support them through those challenges, knowing that there are solutions and ways of overcoming those issues. So that's great to hear. Now, Martha, I just wanted to hear from you. Who do you consider to be sort of the vital team members when for a woman who's, in that sort of postpartum period with a newborn baby, and how do you sort of interact and work with those team members to support women?
I think probably for mums in that early postpartum period, the most important person is probably their partner. So if you have a partner that is supportive and encouraging and understands the importance of breastfeeding, because especially in the early days, mums, they tend to feel like all they do is breastfeed. So if you've got a partner that's going to enable you to do that and look after all the other stuff for you, just to give you that sort of gentle encouragement as well, it's one breastfeed at a time. That's how we learn. So the supportive partner is really absolutely vital. And then, family, and if they can surround themselves with family and friends that are going to support them learning how to be a new parent, and that includes the dad or the partner as well, the dad or the partner, so that they can get on and learn about this new little one that they've brought into the world. That's really important as well. So and we don't necessarily live in those close family environments anymore. Sometimes we don't have family around. We need to rely on the community around us, our friends. the health practitioners that mums see on a regular basis would be, in the very early days, the first week or so, would be the midwives, their obstetric doctors, really important. And then as they go home and they start to, once they leave hospital, of course, they're child health nurses. So those people, they have a really important role for the new mums, because the mums look up to them. And if your doctor or your child health nurse says to you, you're still breastfeeding, that's fantastic, you know, it gives mums that real pat on the back that they need. And they see their doctors and their child health nurses as being an important person that they look up to. So they're really, really important. And then if mums run into a few breastfeeding challenges, well, they need good evidence-based advice. So that would come from the Australian Breastfeeding Association or a lactation consultant as well, if there's one available. Sometimes babies can do with a little bit of body work or sort of craniosacral therapy, but that would be for sort of very specific problems, or if there was a tricky, difficult birth as well. And sometimes the mums benefit from some help like that as well, certainly.
Yeah. Wonderful. Great. So certainly lots of people that make up that team. And like you say, women aren't supposed to do this on their own. It does take the village, doesn't it?
Absolutely. Absolutely.
Yeah. Okay. So I thought, just to finish off, Martha, would you be happy to share your top 3 tips for successful breastfeeding?
I think probably first and foremost, it is that community, to surround yourself with people that are going to support you. There's a lot of talk now about the 4th trimester. So to take that pressure off yourself as a new mum, go home, learn about your baby, watch your baby, be with your baby. It takes a lot of pressure off. And then have those people that are around you to nurture you and support you and make a hot meal for you and get the washing done for you. That's really, really important to get you off to a good start. It's probably worthwhile to do a little bit of learning about breastfeeding before you start to breastfeed, if you can. It's often quite different to how you expect it to be. So breastfeeding is a natural thing, but it's not always as instinctual as women think that it might be. And they do go on this really sort of steep learning curve. So if they run into problems, to get some help as soon as possible. And the help needs to be evidence-based. As we've talked about, there's a lot of myths and misunderstandings about breastfeeding. I think, though, the most important thing of all is to believe in yourself. Believe that you can nurture your baby, believe that your body can breastfeed, your body knows how to do it. You just need to learn about your baby and about yourself and how you do this together. So that really strong belief, and be patient with yourself. Give yourself a pat on the back every time you breastfeed that baby. That's one more breastfeed. You're on that road now. It takes time, and probably a little bit of gutsy sort of determination and persistence to stick with it, because it's not always easy. So yeah, there would be my top 3 tips.
Wonderful, Martha. Thank you so much. I mean, we're just so very blessed to have you in our community, supporting our women with your wisdom and experience. So I'm really grateful that I get to work with you, and the women in our community are able to access your wisdom. So thanks so much for spending some time with me today. And I'm sure that you will have lots of questions come your way after women discover you.
Great. The more the merrier.
Yeah. And also it'll be great. You'll be at the Wellness Festival this year with a stall. So anyone wants to come and speak with you, that's on Sunday, 28th of October in Busselton. So yeah, we'll look forward to seeing you there.
Thanks very much, Sarah.
Okay. Thanks, Martha.
Thank you. Bye.
Bye.